Did you know that before the year 2000, most doctors believed that none of their patients could be deficient in vitamin D? But as the technology to measure vitamin D has become affordable, more studies have been conducted. According to Dr. Michael Holick, one of the leading researchers on vitamin D, the Centers for Disease Control and Prevention, CDC, reports that 32% of adults and children in the United States are vitamin D deficient. That's a pretty big number. For this reason alone, it is important to look for signs of vitamin D deficiency. Research continues. Holick believes that about 50% of the population may be at risk of vitamin D deficiency. The only way to know for sure if you have a vitamin D deficiency is to have a blood test. But the signs and symptoms associated with this deficiency can also be useful. Before we start this video, don't forget to subscribe to our channel for more daily tips like this and turn on your notifications so you don't miss any of our new videos. Here are the signs of vitamin D deficiency. 1. Darker skin. Holick explains that if you have darker skin, you may need up to 10 times more sunlight to get the same amount of vitamin D as someone with pale skin. He adds that the pigment in your skin acts as a natural sunscreen, so the more pigment you have, the more sun exposure you need. Many people don't know that people with dark skin are at a higher risk of vitamin D deficiency. This is because melanin, which helps prevent certain skin cancers like melanoma, can reduce the skin's ability to produce vitamin D in response to sunlight. People with darker skin have more melanin, which reduces exposure to the sun. This means that the body produces less vitamin D. In fact, darker-skinned older adults are at greater risk of vitamin D deficiency. You've got the blues. One symptom of vitamin D deficiency is low mood, according to a study published in the American Journal of Geriatric Psychiatry. To prove this theory, researchers studied 80 elderly patients and found that those with the lowest D levels were 11 times more likely to develop depression than those with healthy D levels. In fact, there are many different psychological changes due to vitamin D deficiency. Scientists say that the main symptoms of SAD, seasonal affective disorder, are caused by variation in D levels. Seasonal affective disorder is a mood disorder that causes symptoms of depression during the winter months when there is less sunshine. The reason for this is the sharp drops of vitamin D in the human body. Altering vitamin D in the brain can affect serotonin levels, which affect a person's mood. Low serotonin levels linked to depression. That's because serotonin is a chemical and neurotransmitter in our body that helps regulate our mood, sleep, social behavior, appetite, and more. If you notice that you feel increasingly sad, especially during the winter months, it could be due to a lack of vitamin D. If so, talk to your doctor about vitamin D supplements, which can help increase D levels in your body and maybe even improve your mood. 3. You are at least 50 years old. Vitamin D is also a very common risk factor among the elderly. The reason why the elderly are more prone to vitamin D deficiency is that, as the elderly get older, their ability to synthesize vitamin D in direct sunlight decreases. In addition to him, vitamin D is activated in the body's kidneys, and this function weakens as a person ages. Seniors also move less and lead active lifestyles as they age. They also tend to stay inside more. According to the International Society of Clinical Densitometry, about 95% of the elderly may be vitamin D deficient. It's not just that they spend a lot of time indoors. Another reason is that they produce less when exposed to the sun. They add that an elderly person over 70 produces 30% less vitamin D than a younger person with the same amount of sun exposure. Researchers say that people should spend up to 30 minutes in the sun at least twice a week to get the necessary amount of vitamin D. According to the Food and Nutrition Board, the average amount of vitamin D that a person should get before the age of 50, there are 200 international units, IU, for men and women. The daily consumption for men and women aged 50 to 70 should be 400 international units. After the age of 70, the consumption should increase to 600 IU for men and women. Therefore, there are many supplements on the market that seniors can use to increase their intake of vitamin D. 4. Obese, overweight, or with a lot of muscle mass. Holick explains that vitamin D is fat-soluble, which means the body stores it. Therefore, if you are overweight or obese, your body needs much more vitamin D than the average person. The same goes for those with a lot of muscle and body mass, he adds. 5. Aching bones. Holick says many patients who visit their doctor complaining of aching bones and muscles are misdiagnosed with fibromyalgia or chronic fatigue syndrome. This is not an uncommon mistake, but I recommend getting a vitamin D blood test done before your doctor makes a diagnosis so you can rule it out if it comes back negative. 6. Sweaty head. According to Holick, a sweaty head is one of the first signs of vitamin D deficiency. He adds that many doctors have asked new mothers if their newborn baby's head is sweaty. Neonatal excessive sweating due to neuromuscular irritation continues to be described as an early symptom of vitamin D deficiency. 7. Intestinal problems. As mentioned earlier, vitamin D is fat-soluble, so if you have gastrointestinal problems that affect your body's ability to store fat, absorption of fat-soluble vitamins like vitamin D can be impaired, says Holick. Sources of vitamin D. According to nutritionists in Canada, good sources of vitamin D include whole grains, orange juice, plain yogurt, deli meats, pork, beef liver, salmon, eggs, fruits and vegetables, tuna, mackerel, cheese, egg yolks, and cod liver oil. Remember, if you have any of the symptoms mentioned, see your doctor because you may have a vitamin D deficiency. Some people are at higher risk of vitamin D deficiency. These people include the elderly, those with milk allergies, those with darker skin, or those following a vegan diet. Symptoms associated with vitamin D deficiency include an increased risk of cardiovascular disease, cancer, asthma in children, cognitive decline in the elderly, and more. Getting enough vitamin D is very important to avoid these health risks. If you don't spend a lot of time in the sun and follow a strict diet that doesn't include many vitamin-rich foods, it might be time to start talking to your doctor about the best vitamin D supplements you should be taking, and how much or how you should take them often. It should be noted that excessive sun exposure has many different harmful effects. Excessive exposure to the sun can cause sunburn, premature skin aging, skin cancer, and skin damage. Did you know that over 90% of skin cancers are caused by the sun? For this reason, researchers often debate the best ways to get vitamin D. Although vitamin D comes from the sun, too much exposure to the sun can cause all kinds of other dangerous health problems and risks that can lead to cancer. Excessive exposure to the sun allows harmful and damaging UV rays to penetrate the inner skin layers of the human body. It causes sunburn and can even kill or damage skin cells that can develop into cancer. While a small amount of UV radiation is good for us because it produces vitamin D, too much sun exposure can cause premature aging, skin cancer, weakened immune system, and more. That's why doctors recommend eating a diet that includes foods rich in vitamin D. Despite this, many foods do not contain vitamin D, which is why vitamin D supplements are increasingly popular. Talk to your doctor today about the best ways to increase your vitamin D levels. Your doctor will probably recommend taking a vitamin D supplement. How do you try to get more vitamin D? Let us know in the comments section below. Whether it's sun exposure, dietary changes, or supplements, sharing strategies can help others maintain optimal vitamin D levels. Did you like this video? We hope this information helped you understand the importance of vitamin D. If you liked it, don't forget to hit the like button and subscribe to our channel for more in-depth health and wellness videos. Turn on notifications to be up to date with our latest content. Thanks for watching, and remember to take care of your health.